Welcome to Colonie TV, the governmental educational channel for the town of Colonie.
My name is Dean. I'm a person in long-term recovery, and this is Inside Addiction. Researchers say the number of adults over 50 with substance abuse problems will double from 2.5 million in 1999 to 5 million in the year 2020. My guest today is Nicole McFarland, licensed clinical social worker, credentialed alcohol and substance abuse counselor, and executive director of Senior Hope in Albany. Welcome to the show.
Thank you so much for having me.
Nicole, you received your Bachelor of Arts from Skidmore College and your MSW from the University of Penn School of Social Policy and Practice. You're currently a doctoral candidate at the University of Albany Social Welfare School in completing your dissertation in the area of geriatric addictions. Nicole was promoted in 2012 to the position of Executive Director of Senior Hope Counseling after serving as clinical director for 8 years. She has lectured locally and nationally on the topic of geriatric addictions and co-occurring disorders among older adults. Her publications include a book chapter, several articles, and a National Association of Social Workers online continuing education course. You were the recipient of a Hartford Doctoral Fellows Pre-Dissertation Award and the 2009 Individual of Distinction in Addictions Education and Training Award for New York State. In 2010, you were honored as Social Worker of the Year for New York State at the annual National Association of Social Workers New York State Conference. Your community service includes your leadership roles within the National Association of Social Workers as delegate to the National Delegate Assembly representing the Northeast Division of New York State and representative to the Committee on Nominations and Leadership Identification for the National Association of Social Workers Northeast Division. Thank you for joining us.
It's an honor.
Nicole, is senior addiction a problem in New York State and nationally? If so, to what extent?
The baby boomers are growing in unprecedented numbers, and the need for addictions treatment is growing as well. Currently, we just do not have sufficient services in place and trained staff to meet this growing need.
Can you share some information about Senior Hope Counseling?
I would love to. Senior Hope was founded in 2002 by Dr. William Rockwood and Adrian Rockwood. They realized that their age cohort was going untreated when it came to age-specific services. And they decided it was really important to pour in their time, energy, and resources to develop Senior Hope Counseling. So we have been in business since 2002.
Wow.
And we have moved from a prior location to 301 South Allen, where we've been able to expand our programming.
What are some of the specialized programs and, in particular, the mission of Senior Hope?
Senior Hope is designed to provide caring, compassionate, science-based treatment for older addicted adults, 50 and older, and their families.
What services are offered and what specific population does Senior Hope serve?
We serve individuals, male and female. Originally it was 55 and older, and due to the need in the community, we decreased that age to 50 and older. So we have seen individuals as old as 79 and as young as 50. On occasion, we make an exception, 49, 48, if there is a need. We say 50 is the new 30 and 60 is the new 40, and we just keep going from there.
So I'm 40, so that would make me 20?
Oh, you're 20, no doubt about it. It's all a state of mind.
What issues are specific to the senior population, and what unique challenges do they face?
There are a host of challenges that older adults face, including isolation, alienation, retirement, change in physical dexterity, loss of financial stability. These are just a few. And what Senior Hope has done is listen to the elders over the time and custom tailored our programming to meet their unique needs.
Tell me about the staff at Senior Hope, and how would the staff differ at Senior Hope as compared to a adolescent facility?
That's a good question. At Senior Hope, we really do our utmost to bring on board staff who have expertise in geriatrics, as well as addictions and mental health. We have a seasoned interdisciplinary team of dedicated professionals, including licensed social workers, CASACs, and we have had PhDs over the years.
Nicole, let's talk about some of the themes that have emerged recently and over the years relating to older adults and addiction, such as how do seniors benefit from being treated with individuals their same age, talking about age-related issues, and they're experiencing a true connection when they're able to relate to individuals who are at similar life stages.
That is a critical question, and essentially what we have noted over the years is that seniors feel very comfortable when they're among their same age cohort because of the generational issues that they have dealt with. For many of our patients, the services were not in place back when they were growing up to help insulate them from child abuse, child neglect, a variety of different issues that now what we're seeing is the services are expansive, and we have CPS, and we have legal guardians, services that our elders probably wish they had had back then, but they just were not in place. So oftentimes when they're in the rooms, some of them for the first time are disclosing information about early childhood trauma.
At 50, 60, and 70 years old,
Exactly.
This is their first opportunity.
Exactly, and this is why we worked collaboratively with the University at Albany and rolled out the ACE questionnaire at Senior Hope. It's on adverse childhood experiences, and it helps the patient plus the clinician get a greater sense of whether or not there was trauma prior to the age 18. In addition, we established a trauma recovery group where these older adults are now able to really express themselves and share how this has influenced their addiction, their mental health, and their physical well-being. So bringing older adults into a room, talking about age-related issues and life stage similarities is absolutely critical.
So let me ask you a question. When that's not the case in other modalities or other settings, have you ever experienced, have seniors that you've worked with ever told you that when they're with younger people, they kind of lose their identity or the reason that they're there, and they almost become maybe like a mom or a dad figure or a grandma or grandpa, and instead of seeking and receiving the services that they need, they almost become caretakers and the focus comes off of them. Is that ever the case?
They have articulated that quite often in the rooms at Senior Hope, and we know that tremendous work is being done across New York State to help all ages who are suffering from addiction. But for individuals 50 and older, given their age, a lot of times they share with us that they naturally take on that parental role and begin to focus on everyone else's issues while their own issues get lost. When they're at Senior Hope, they're able to really connect with their fellow cohort and they're able to reminisce on generational experiences that only someone of a similar age group
Yeah,
could.
do you remember when?
Exactly. They also, we find, you know, there's very little use of profanity, practically none, and they really appreciate that kind of environment where there's no use of that.
Do older adults benefit from the smaller groups that tend to focus on, the more age-specific topics run by professionals that in particular have geriatric addiction or a mental health background, do you think?
Absolutely, and it's critical to be able to not only have a group facilitator that is seasoned, but also to have someone who is aware that talking slower and having smaller groups and maybe writing larger on the board is critical, because our older adults oftentimes, they have loss of vision, loss of hearing, loss of physical mobility, so they need you to talk louder so they can hear, and they need you to go a little bit slower so they can really embrace what it is that's being said.
How about even beyond that, when I think of the elderly and older population and some of the needs, such as literature or readings, and I'm thinking what could be useful, like, even something as simple that we take for granted, you bring up our vision, like larger print.
Right, exactly. One common theme that has emerged in the rooms is that, when older adults who are addicted go into rehabs, it's quite fast-paced, and it's from early in the morning to late at night,
Yeah.
and it is pretty much geared for a younger group. So they get tired. They don't have that same ability to get through such a long, intensive day. They do need larger print, and if they have loss of hearing and they haven't yet wound up getting hearing aids, they need a facilitator who is sensitive to talking louder. So there are definitely inherent issues, and there are so many differences in the life stages. For a younger individual, there may be issues around school, there may be issues involving CPS. What we find with older adults is that a lot of times, retirement is leading to depression, to grief, to loss of the same income that they once
I don't get up.
experienced.
It's almost like the purpose in life. Like, why do I get out of bed now? I don't go to work. I've gone to work for 20, 30, 40 years, and then I retire. Obviously, the kids have left the nest. The grandkids may be even getting older. So again, now what is my role as an older adult?
Right, and part of the work we do at Senior Hope is to help them regain some of that meaning and purpose, because if an individual has meaning and purpose, which may differ from what they experienced in their 20s and 30s, then that can really inspire them to get up and get out and not be as isolated in their home. When I talk about meaning and purpose, sometimes that can result in them finding a volunteer position that interests them, that they can feel like they're contributing to their community, getting involved in a religious organization, getting more involved with family and friends. For the individuals who come to Senior Hope who don't have a strong social support network, family network, it's a harder journey, I really do believe, for them in their recovery.
Can I ask you a question? When we talk about generational issues, how significant is it with the older population of, if we don't talk about it, it's not a problem, like addiction, alcoholism, drug abuse? This is nothing new. The 20-year-olds nowadays have not invented popping pills. The 30-year-olds nowadays in the rooms aren't the first people that ever drank.
Right.
People have had substance abuse problems for years and years. So how does that play into the role of someone seeking services even getting past that initial point of, denial?
Well, that is something I've often reflected upon. And these days, it's quite hip to say, I'm going to an AA meeting and then I'm going to see my shrink. Whereas back in the day, the services were just not in place.
Yeah, they weren't even available.
And so it naturally led to a feeling that you couldn't talk about it and you couldn't express if there was a problem in the home.
Closet drinking.
Exactly. And we have to be mindful that with this older generation, the family forum looks a lot different back then than it does now. It was not uncommon for our older female patients to be the mother of 4, 5, 6
Leave it to
children.
Beaver,
Yeah, many children.
June Cleaver.
Right. And the father, a lot of times, was the main breadwinner. So there was, that built-in dynamic. And so if dad was drinking quite a lot, mom was doing her utmost to rear the children and take care of the home, but she may not have developed skills outside of the home, which then, as we hear at Senior Hope from the older female patients, resulted in a greater dependency on the alcoholic. And what do you do? How do you cope?
Stigma is a real hot topic now when it comes to addiction and kind of removing the barriers to treatment and breaking down stigma, raising awareness. What in particular and how important is it, the connection of stigma to engaging and retention of older adults who may seem more ashamed of their substance abuse or their mental health? Is stigma an issue among the elderly population?
Very much so, and sometimes it really acts as a barrier for them to even take that initial step to want to engage in treatment. So it's not uncommon that we may have an individual who is sent to Senior Hope by an adult child or perhaps the legal system. And what we try to do then is help them see that they're not alone in their plight, that there are other individuals of similar age struggling with similar issues, and that what once was considered taboo to talk about is now more open, and that it's okay to share that you're suffering and struggling and begin to look at why. Were there adverse childhood experiences, for one?
Let me ask you, the concept of a functional alcoholic or a functional addict, does that become a barrier too when engaging the elderly population? Do you ever hear, look, I'm retired. I worked this many years, or, I'm retired. I raised my kids. I helped raise my grandkids. The whole concept of a reward. I earned this, or, is that a tough argument to fight if someone says, hey, look, I've been drinking for 50 years, or I've been doing this for 50 years.
We often say to them, what kind of legacy would you like to leave behind? Would you like to be remembered as grandma or grandpa who fell off the stool in a drunken stupor and, died? Or do you want to be remembered as grandma or grandpa who had a vital role in your children and grandchildren's lives? So often when we say that, it really hits home because they are in their third stage of life and they may not have another chance to turn it around. So what we actually see at Senior Hope are individuals who are quite motivated to embrace recovery and to get it right this time, if at all possible. But we do believe in harm reduction at Senior Hope. And some individuals are a bit resistant when they first come in, and they may be at the pre-contemplation stage of readiness for change. So we help them, and we do our utmost to custom tailor our approach to meet the needs of individuals where they're at.
I love it, the individualized treatment across the board, because there is no cookie cutter approach. There's no cookie cutter approach with any generation. Everyone's needs are unique, and I believe that's the key to successful, long-term, sustained recovery, is finding what works for what person. Because in all honesty, you know, who cares if something worked for John if it doesn't work for you?
Exactly.
And you're in need.
Exactly.
It doesn't apply. It won't work. Why age-specific services versus mixed age group treatment? Why not the one-size-fits-all method of treatment for seniors with substance abuse?
Well, you know, in working at University at Albany's School of Social Welfare on my doctoral dissertation and working at Senior Hope as executive director, I have come to realize over the years that when you provide a custom-tailored approach and understand that different age groups require unique, specialized services, that their outcomes and the rate at which they're going to engage in treatment and have successful outcomes is substantially higher if you're custom tailoring. And so my doctoral dissertation looked at clinics across New York State. They are doing tremendous work to help all ages. But as we all know, the baby boomers are coming of age in unprecedented numbers, and they are seeing greater numbers of elders. So many of those clinics are doing their utmost, you know, to meet those growing needs. But I do believe, as evidenced by this dissertation, that we need to help clinics across New York State develop specialized programming, even if it's within their mixed age group settings, so that they are sensitive to some of the themes that we've been talking about today when those elders continue to come into their clinics.
Yeah, I can't think of the fact that the number is going to double between 99 and 2020 from 2.5 million to 5 million. I can't think of another population that's going to have that great of an increase other than the persons over 50 with a substance abuse problem. What else is critical when working with older addicted adults, such as, talk a little bit about the connection of services within the community. You know, you mentioned sometimes older adults may feel too tired, they may have a disability, they may feel overwhelmed or alienated. How do you identify what services within the community can help them?
Well, you know, there are wonderful organizations in our community that are geared to help elders with housing, with Meals on Wheels, the New York State Office for the Aging, just an example, and Albany County Department of Aging. And so what we try to do is when an individual comes into Senior Hope, we look at the full spectrum of issues that are influencing and impacting their mental wellness and their recovery. And if they are in an environment that's not conducive to recovery, they may need an alternative option for housing. So they may not even be aware of the services they're entitled to, such as decreased subsidized housing for elders. They may need assistance just with basic maintenance, and there are programs like the Umbrella that service elders and help them in their homes with, you know, functions like that, and Meals on Wheels. So the clinicians are nicely positioned to help match services in the community with the needs of the older adults by gaining greater awareness as to what they are.
So that's great. Someone comes into Senior Hope and it's not just, hey, look, all we're going to talk about and help you with is your substance abuse. We can't help you with that. So it sounds to me like a one-stop shop.
Yes, and we offer 12 age-specific groups geared exclusively for 50 and older. We've listened to older adults over the years and realized that they have some very specialized needs, and we want to match our clinical programming to meet those needs.
What are some of those 12 specific groups?
Well, we do feel that elders can benefit from the trauma recovery group, which is tied into the ACE questionnaire, and it gives them a safe environment in which to express some of those earlier year experiences that they may never have articulated were a problem for them. We also have groups that are focused on the mental health and recovery, because so often older addicted adults have anxiety and depression, and so we want to talk about the stage of life that they're in that group as it impacts their mental wellness and addiction. Additionally, we have relapse prevention groups, women's group, men's group, a whole host of groups really targeting this population needs.
Similar to other age groups, does the elderly population, do you find, is there a big incidence of them simply self-medicating themselves?
Yes, we have had quite a few who use the alcohol or other drugs to cope with issues that they have never had an opportunity to talk about and resolve. And when they begin to realize by listening in the group dynamic that they are not alone and that similar experiences are, you know, a part of what other men and women their age are going through, it's a freeing experience, and they're able then to really talk about some of the tragedies that have happened in their lives and learn better ways of coping through cognitive behavioral therapy. We also believe in productive aging perspective, because as we age, we should feel that we can contribute to our society. We shouldn't be told that we should just retire and go off into the sunset. We have great knowledge as we age.
Wisdom.
Exactly. Incredible wisdom.
Yeah.
And these individuals, I mean, their stories are just incredible. So they should be able to give back in a manner that is manageable at that stage in their life.
What do you think is needed in New York State and across the country to meet the growing problem of aging baby boomers, and in particular substance abuse?
Well, for starters, what we're doing here today is absolutely critical. Having an opportunity to share the information across, New York State, and through social media, and also through writing, through literature, to let individuals know what evidence-based practice is working with this age cohort. In addition, I feel that by helping clinics across New York State take a look at what their current programming is to meet these elders' needs, and then looking at enhancing that programming to be more custom tailored to their needs will make a profound difference.
Nicole, in the last few seconds, what can you share with viewers to help them if they're a provider, caretaker, or individual in need of services? What advice would you give them?
That to really look for signs of that elder, and to see if they're showing evidence of bruises that are unusual from falls, lack of attention to hygiene, changes in their daily routine. There is help and there is hope, and Senior Hope is here to assist older addicted adults and those that care for them. Our number is 489-7777.